So I've been in the healthcare industry, and having been through that experience, I really wanted to focus on the consumer side and just change how healthcare knowledge is shared, which is the mission of my podcast, Get Savvy, Demystifying Healthcare, is to really change how healthcare knowledge is shared so people die every day because of what they don't know and getting the healthcare. It is so important. You asked me about what a tidbit I would leave folks with, and that is being your own advocate. I truly, and I hear physicians tell me this all the time, it's a partnership in health.
Welcome to the Wheel With It podcast with your host, Devin. Let's get into the episode.
Hello. Welcome to another episode of Wheel With It. I am your host, Devin Wieters, and today we have Sandy Kibling on the podcast. How are you, Sandy?
Oh, Devin, thanks for having me. I'm doing great today. I'm glad to be on the show and really appreciate, and I was super excited to have you on my show as well. And we'll have that podcast out in a few weeks to share all your knowledge. Thank you for having me on today.
Yes. Oh, in love with your podcast and what you're doing. And so I'm like, I have to have her on mine. So as many folks as possible can hear about what she's doing because I think it's amazing. Please tell us a little bit about what you do with the podcast and with your career and why you decided to get into what you got.
Thanks so much. So I have been in the healthcare industry for like 10 years. I work for a large healthcare insurance company, working on the provider contracting side. So getting those contracts in place with the insurance company so folks can go and see that in-network provider. So I did that for a while. And then I just, having been in the insurance company, I just really, because I also was working in provider relations. So in provider relations, you get all the complaints and concerns. So they always came to my team. And so it just really brought an awareness of just how frustrated I think consumers are with our healthcare system, how complicated it is to navigate the system, to understand. And I'm talking smart people at the end of the day, but just trying to understand, what the different types of plans are once they buy a plan, understanding the whole authorization process, understanding network and referrals. You need a PhD to get yourself.
Yes, you do. And if you're Medicaid, you need like a postdoctorate like fellow or something.
100% on that. So I've been in the healthcare industry, and having been through that experience, I really wanted to focus on the consumer side and just change how healthcare knowledge is shared, which is the mission of my podcast, Get Savvy, Demystifying Healthcare, is to really change how healthcare knowledge is shared so consumers are empowered to make smart healthcare choices, because we've got to find a better way to do it. And so I'm doing that today. I'm also an insurance broker, so I help folks, Medicare, individual families find the right plans, licensed in Colorado, where I'm currently at. And I also serve as an advisor for other states for people who are like, I don't know where to begin, what to do. So it's a little bit about what I do today. Again, my mission is just to serve and make sure people are informed and empowered to make those ever important decisions, whether you're taking care of yourself and or taking care of a loved one.
Tell us what the podcast focuses on and what kind of guests you've had on, and then what kind of feedback, how it's helped folks.
Yeah, thank you for that. I will say when I was thinking about the podcast, number one, I thought of three things. And number one, I thought of people go into financial debt, medical financial debt, because of what it is they don't know. They get hit at a red light by Johnny Joe Texter. They have this large hospital bill, and they have all this financial debt because of what they don't know. Number two, people can live debilitating lives with a chronic illness. I knew of someone who had severe knee and severe back pain that really left her housebound. And she just didn't know what she didn't know. I mean, very bright person, but again, healthcare is complicated, and she wasn't accessing the care that she needed. And third, not to be morbid, but true, some people die every day because of what they don't know and getting the healthcare.
It's true.
It is true. And it is a sad fact, but I think it's time we have a real conversation about it. But I think that really inspired me to what can I do to help consumers understand. So that was the start of the Get Savvy, Demystifying Healthcare. And I thought, how can I demystify healthcare? So I started off by I cover a range of topics. That's the start, whether it's mental illness, whether it's being an advocate for you or your loved one, whether it's the top three things need to do before having a surgery, because these things are, I don't know where anyone's at on their healthcare journey. So I try to cover a variety of topics so that people are aware can find the topic that they need to hear at the time, and certainly with what they're currently dealing with. And sometimes it's me and the mic, but for the most part, I love to have a guest on because I believe in the power of storytelling. I just interviewed someone this morning, and she really tells her story of having lost two of her loved ones to cancer. And she talked about how she rallied with her family to be an advocate, to ask those questions of providers, and to really help her loved ones. And so the power of storytelling and then answering and providing content to the questions that listeners have is just really essential, I think, to provide people what they need so they can, again, say, gosh, I'm stuck. This is where I'm at too. Let me listen to that podcast. There's some great resources. There were some great ideas. I can apply them to my situation. And that's what I want listeners to walk away from when they listen to that podcast. That was a great use of my time. Got what I needed, got resources that I can research. And so that's really one of my main missions behind the podcast.
So which episode do you think is the most helpful, and what is the best piece of feedback you've gotten about how it helps somebody?
It's really interesting. I've interviewed, because you asked me this too, everyone from, I've had on Gina Mundy, who's an attorney focusing on a childbirth cases gone wrong. And so she was an amazing guest on there. Dave Mowry, who's a stand-up comedian who deals with his bipolar illness through stand-up comedy. It's how he processes and helps others with that. I've had physicians on who really just tell their story of what it is like to be a physician trying to care for you, the patient, and the struggles that they have and how they can work better with you. I've had Mandy Capehart on who talked about grief illiteracy. And I'm like, okay, I don't even know what that is, but she really talked about people processing grief, but being illiterate and not knowing how to do that. It's one of actually my top downloaded podcasts as well. Really, my mental health are really top downloaded podcasts, but I also cover everything from Medicare eligibility to what's the difference between an HMO versus a PPO and open enrollment, and trying to figure out those plans. I talk a lot about caregiving. Myself and my husband are caregivers to my sweet mom. And when you're trying to navigate the system to care for yourself, and in fact, you and I talked about this as well, trying to navigate for a loved one and my father-in-law and trying to get Medicaid for him. It's a challenge at the end of the day. So that's kind of topics that I cover. The feedback that I think the most profound that I've gotten from someone is, wow, I'm so glad you're doing this, because I just can't find anything else out there like that. And that really helped me either find that comfort or help me find a path that I need to be on to help myself or to help my loved one. And those are the comments that I want to hear, because that's the mission that I have to serve.
That's amazing. So tell us what have been some of your favorite episodes, and what is one good tip that you learned?
Yeah, no, I love Dr. Lysander, and he was a physician, and he was just tired. He went to med school, and he was just excited to serve, but was so disheartened. And I find a lot of physicians are this way of working in the system. Okay, let me just see this patient for 15 minutes. He was in physical pain and management was his specialty. And he'd see a patient for 15 minutes because that's all that he was allowed to. And he really couldn't get to the heart of what the issue was for their back pain, because that's what he specialized in. So he said, I'm done. I'm done with health insurance. I'm going to go out on my own. My patients are going to self-pay, but they're going to get the care they deserve. They're going to get to a resolution they deserve to live a quality life. He was absolutely amazing. I mean, he took a risk, but it was just a wonderful story, because I think in healthcare, our physician groups, when we think about getting our health insurance and who's in network, a lot of physicians are saying, I'm going to take a different path. I'm going to go concierge medicine. I'm going to go direct primary care. So Dr. Lysander really presented a great light on that and was very helpful to me to understand what physicians are going through. I had a great interview with one of my mental health providers. I'm happy to provide the link. She was amazing, but she really specialized in couples therapy and so many others, and just family therapy. But she really talked about her experience as a therapist with working with soldiers with PTSD. And she actually went to a base camp and worked with soldiers, and really told her story of how she helped them and their families cope. So I would just tell you, Devin, every day I'm enlightened and blessed by hearing people's story, stories and what I learned, because you asked about that as well. I mean, I learn is just, thank God there are other people out there taking their experience and giving it to others. And I'm so grateful to have the vehicle that I have with my podcast to share that story, to help others wherever they're at on that path, to find the comfort, to find the resources that they need, again, to help them get the healthcare they deserve or to help their loved ones get the healthcare they deserve.
That's awesome. Have you read Johann Hari at all?
I don't think I have. No.
First of all, you need to look him up and read him because
Okay.
he writes books and they're massive. Don't beat yourself up if I can't get through all of them. I have, but that's because I have a lot more time to read than other people do. But they're massive. So you can also get them on Audible and he will read them to you in his lovely British accent because he's a Brit.
Uh-huh.
He writes, he lives part-time in the UK and part-time in the US to research his books. And I am meticulously researched. When he's writing, that's all he does. Like, he doesn't do any interviews. That's all he does is write. And it takes him like years to write one book. And he writes about different systemic issues that we have going on in the US and the UK as well. And so he wrote, his latest one is about the obesity crisis. His first one that put him on the map was about the addiction, how we treat people with addiction, like drug addiction. And he has one about the attention crisis, how we can't focus on anything and pay attention. And he goes really hard on the social media companies in that one and like how it's like designed to addict us. So reading recommendation for you. And he was saying that too about the grief illiteracy and the one I'm reading right now, Lost Connections. He says that people who are grieving, doctors just diagnose them as depressed and throw the antidepressants at them. And it's not depression, it's grief. Like, you're not normal if you don't grieve, kind of thing.
Yeah, that is so true. And Mandy talked a lot about that in her podcast. So I appreciate the recommendation and you saying that, because that is having knowledge. And that's one thing I tell you is everything. With the environment changing, we don't know what's here today, gone tomorrow. It is so important. You asked me about what a tidbit I would leave folks with, and that is being your own advocate. I truly, and I hear physicians tell me this all the time, it's a partnership in health. Its physicians are busy. They're also working in a complicated and mired bureaucratic system. So being that good patient as an advocate, asking those questions, your depression scenario, just saying, this is what I'm struggling with, asking those questions, open-ended questions, be an advocate, have someone with you to help you understand, not to be intimidated by white coat syndrome, but to be able, and I'm not being condescending to any consumers because
It took me a while to get this, but like not anything extreme, but I have like the teeniest bit of white coat syndrome. So it's like in doctor's offices, I'm fine, but if it's like hospital setting, I'm like, I don't want to be there. And so, yeah, definitely have someone with you that can remember all that was said because you're not going to be able to, even though I have a good ability to understand stuff despite drugs because I'm used to it by now. Definitely don't want to have go alone. Like, no, that's not it.
Yeah, no, and so being the advocate, and I think part of being the advocate is having the knowledge. I actually covered an episode to help people really understand is who are you seeing really? Because I get this complaint a lot is that, so I was actually having lunch with someone recently and she said, yeah, I signed up to see Dr. Susie Q. Jones, but MD, but I never saw Dr. Susie Q. Jones, MD. I didn't see the physician assistant. So what is that right? Is that wrong? I'm confused. And so helping people understand when you go into the office, when you see an MDDO or not, and you're seeing the physician assistant. I'm not speaking ill of our mid-level providers, registered nurses, nurse practitioners,
No.
amazing. But if you're going in for a concern, you want to see the MDDO, why is that not the case? So having that knowledge and understanding, we talked about this, but I recently talked about how I changed dermatology groups because I was always being seen by the physician assistant who was amazing, who had 2 years of training and on the job training for skin checks. And I'm like, wait a minute, this isn't right. And I actually changed to a group where they have all board certified dermatologists. But part of that one is knowing, and part of that two is saying, I need to make a change. I'm going to be an advocate for myself. I'm going to make that change so I can make sure I'm getting the care that I deserve and need. And so that becomes pretty powerful as well.
I could do a whole nother episode with you. Just like the care side of things, it's just unbelievable what they don't know, like what people, especially with special needs, like don't know about. Incredible. And if you're seeing the physician assistant, I love them, but chances are that they don't know everything either. So you need somebody that knows everything, and your Indeed has a better chance of knowing everything.
No, absolutely. And I do think out there today, there is a lot of, and again, I always say this, I'm not speaking ill of anyone, but I do think there's a lot of groups that kind of do, like the dermatology group that I left. I saw the board certified dermatologist once, and then for the next 2 years, I never saw him again. And that's right, wrong, or indifferent. That was not okay with me. So I do think that we have to be in, like I said, that partnership and care is really, really important. I mean, I was talking to someone on a show, and we talked about what are the three things that we need to do, and whether that's researching that provider. We talked about resources to make sure that reviews of that provider, if there are any stipulations on that license, questions we can ask. I love what I recently talked to someone about was asking those open-ended questions. I think the example we gave was she was talking about her mom, and she was saying, you ask the question, does my mom need to run? And the doctor says yes. Versus saying an open-ended question to say, what kind of exercise would be best for my mom? And then you engage that provider to say, and it's a more open-ended question. But I think, again, asking those questions of your care team, having the courage to do that, being aware of who you're being seen by is so important, because I always say this to everyone, you get to choose too. And I think ultimately providers want to do the best that they can, but sometimes they're limited in the system that they're working in. So I think it's important to ask those questions, ask those open-ended questions. And if you're not comfortable, make a change.
What are some resources that folks can go to get a better understanding of healthcare?
Yeah, on the web, I have my website as well called Savvy Healthcare Consumer, just like it's spelled, and I'll pass these on to you as well. But on there is you can actually access the podcast, and there's blog post if you just feel like, hey, I just want to read it, or if you're like my mom, you just want to print it out in a PDF, you can do that as well, or transcript. But I also have my podcast listing there, and you can see all the different topics. And the reason why I mentioned the topics there is in the show notes, I always put the resources. Example of that, I interviewed Sue Robati, who really is an advocate for helping people understand the interactions of different prescription medications with one another. And she provided a great tool that I've used quite a bit that says, okay, I'm taking prescription drug A, B, C, and D. What if I want to take this herb or something else? And it will tell you free of charge what the interactions would be. But that
is amazing. What is that website?
I will give that to you. I don't know it off the top of my head, but I will post that. I will give that to you so you have it, and I'll actually link to her or send you the link to her website, to her to the interview, because she was absolutely amazing. But I've used it a lot because a drug tracker, but I'll figure it out for you. I'll send it to you so you can put it in the show notes. But that was a great tool. But within each podcast, I just encourage people, whether it's Apple, Spotify, you can look at the topics, and then just within that are just amazing resources that my guests have provided that I think you can use for you or a loved one.
That's amazing. That drug tracker website sounds amazing. Where can people get in touch with you, and anything else you want to add?
Yeah, I mean, there are by Savvy Healthcare Consumer is a great way there's a contact information or link on there that you can reach out to me if you have any questions. I do have I mentioned my insurance side, which is Advocate Healthcare Consulting. And again, I'll pass this on to you as well if you're stuck on the insurance side and need some guidance and stuff. And in terms of kind of closing thoughts or what I would leave people with, but number one, knowledge is your superpower. And I know when it comes to healthcare, it's like I'd rather listen to podcasts on gardening or politics or whatever, but
reality
TV. But the truth is, I mean, to listen to episode like 30 minutes or something could really, it's on a topic, whether that's mental health or whether that's, oh my goodness, it's open enrollment. I mean, checking out my podcast I think will really provide some enlightenment on some of these topics that people have. And again, those resources that they need. So number one, knowledge is your superpower. Two, you have to be your own advocate when it comes to healthcare. Again, asking questions, making sure you're seeing the right provider that you need. And three, when it comes to health insurance, it's complicated, it's hard to navigate. And I often say, as an insurance broker, and again, as an insurance broker here and licensed in Colorado, it's no charge to people to seek my services to help them. Insurance companies pay me, so it's not any pocket out of the family. But in other states, if people are looking for an advisor or consultant, I mean, a very low charge for services, but what truly having the data in front of you and getting your questions answered can save you money in the long run. The last thing you want to do is get an insurance plan that is not going to serve you and your family for the needs that you have, whether that's an upcoming surgery, whether that's an emergency department visit or chronic illness. You want to make sure that you have a plan that's going to be cost effective but serve your needs. So those are kind of 3 tips that I would give people on that.
So what can we do to make this easier, just from a policy or logistics standpoint?
I wish I had an answer there. I often say I don't run the federal government, but what I would say to someone, I had this conversation recently, is that, and I don't mean to sound redundant in this, is knowledge really is your superpower. And just, I'm give you an example. I'm dealing with a dear friend of mine who is so close to me, and she has a child who is very disabled and really struggling. Her family depends on Medicaid a lot. And they're very concerned about some of the changes that are up and coming of how they're going to care for their child if Medicaid gets cut. Again, I don't get into political conversations. That's not where I'm coming from. But these are real situations. If something changes, and she's greatly worried about that because the Medicaid provides the care her child needs. Medicaid allows this person to be a certified nurse, to be able to stay at home to care for her child. And what if that changes? So that I say that lovingly, we can't keep our head in the sand. We have to be aware of what those changes are. And we have to acknowledge as our superpower to say, I'm going to listen to that resource. I'm going to look at those resources so I can navigate or shift if I need to, if that policy changes, or if we've had health insurance companies here today, gone tomorrow. What are my options if this happens to me? So I would encourage people to be vigilant and stay current on what's out there, and understand that if something happens, just make sure that you're aware of the resources and the power of knowledge to help you navigate the path you need to be on given those changes. Like I said, that kind of goes back to where whatever changes happen, they happen. I just think that's where it becomes being mindful so that you can make the best decision for you and just know what your options are. An example of what I mean by that is that I knew of someone I used to see her at the deli every day. And she had asked me one time, knowing what I did, and she said, Andy, I can't afford health care. What do I do? And so I talked to her about direct primary care. And I have a podcast on this as well, where she could pay a monthly fee and get access to a primary care, get her blood test done, get her wellness exam done, kind of have a gatekeeper, so to speak. If she fell, slipped on ice, she'd have somebody to go to. And she said, you can afford $50 a month. I feel good about that. But I also shared with her what the risk was going without insurance, going back to Johnny Joe Texter hitting her at a red light in a hospital stay, she would be out of pocket. So there's pros and there's cons. But I believe it was important to share with her what options she had. She didn't have to go without, but there was a risk with that as well. And I just think it's important to be able to share that with people. Things change. If you say, gosh, care all of a sudden gone up, I'm making this up, by 80%. What are my options out there? What can I do? And again, not to sound like a broken record, but knowledge is your superpower here. And if there's ever time to keep your head up and informed, now's the time to do that.
And tell her not to be afraid to go to her local community service board and see if she can apply for Medicaid.
Yeah.
Because Medicaid might be a good option for her too.
Yeah, it's an excellent point. And that's one of the other podcasts I did that comes to mind is, what if you have no health insurance? What are your community resources? You don't always have to go without. I was talking to someone who had some severe dental pain, and dental coverage is never covered really well under any plan.
Virginia, again, best state in the union for Medicaid, just started covering dental under their Medicaid. a couple of like maybe 5 or 6 years ago, no, dental coverage is not easy to get.
It's not. And in Colorado, again, Medicaid is state by state based. And if you have kiddos, those are going to be taken care of. But if you're an adult with maybe wisdom teeth pain or whatever, but I provided within there's some community resources. And again, you'd have to look at that by state, but there are dental schools and places like that. You can get a teeth cleaning or you can get a tooth pulled if you're living in pain. So there's options, but you just have to know where to find them and how to reach out. You don't have to live in pain or live in concern and putting your health off and putting off those preventative tests, those things that need to be done can cost you. So it's again important to have that knowledge.
Anything else that you would want to add?
I'll provide you those resources, especially that drug tracker link, so you can put in the show notes. But no, I just appreciate you giving me the opportunity to share about Get Savvy, Demystifying Healthcare. I'm on Apple, Spotify, all the main players, and I've been doing this is my third year of my show, and I just hope that the topics covered resonate with people, providing the knowledge and resources that they need to live their best life.
That is amazing. And we will see you guys next episode. Bye, guys.
Thank you for joining us. We hope you enjoyed the show. Remember to follow the show and our guests on social media and subscribe. Be sure to hit the bell so you'll get notified when we upload new episodes. See you next time.